Hello, everyone, and welcome to this month's webinar. COVID-19 continued the long haul effects on policy and personnel in the workplace. This free webinar is available exclusively for our customers enrolled in our subscription services. I'm Stephanie Blicky, the Corporate Accounts Executive for Personnel Concepts, and I'm joined by my co-moderator, Leon Firesen, who serves as our Senior Regulatory Researcher.
Hello and good afternoon, everyone, and to all of our attendees. On today's webinar, we're hosting two guest speakers to deliver guidance on today's topic. First, I'd like to welcome back Jeffrey Attorney Fucci, who will cover the top 10 issues affecting business stemming from workplace laws and mandates in response to COVID-19. Now, Jeffrey is a graduate from Vermont Law School with a dual master's degree in JD and serves as in-house legal counsel to a diverse group of corporate clients. Jeff provides counsel to his business clients on matters including labor disputes, employment negotiations, anti-discrimination, workplace policies, equity agreements, non-disclosure agreements, and general consultation.
Thanks for having me, Leon and Stephanie. The fall of 2021 has marked a turning point in history with COVID-19, as most children return to school and many businesses forge ahead towards a full reopening. At the same time, the Delta variant looms in the background, breakthrough cases are occurring, and many remain unvaccinated. Today, we'll offer answers to questions which have been coming to us consistently from employers as the pandemic situation evolves in real time, drawing on the latest industry trends and guidance from federal, state, and local governments.
All right. Thank you so much, Jeffrey. To assist our audience with staffing and recruiting issues in response to the effects of the pandemic, we have human resources expert Ashley Taylor. Ashley Taylor, lead consultant of A. Taylor Management Consultants, LLC, is an NYU certified human capital management professional with over a decade of experience in helping multi-sized businesses and startups develop their culture identity while growing their teams in domestic and international markets. Ashley's focus on carefully curating the employer and employee experience was developed after years of HR consulting in the entertainment, financial, real estate, medical science, marketing, and technology industries.
Thank you for the introduction, Stephanie. In a normal year, being a business owner-operator comes with a unique set of challenges and opportunities. The past year has changed the landscape of the workforce, with more Americans experiencing unemployment during COVID-19 than any since the Great Depression. Depending on your industry, you may find yourself in need of help sooner rather than later. Or if you already have a team, you may require some different skills than you currently had to round out your workforce and meet the consumer demands. Today, I'm here to offer some tips on how to address the staffing needs of your business.
Great. Thank you both, Jeffrey and Ashley. We're definitely looking forward to discussing these topics with you all. Before we proceed, we want to make sure everyone is able to hear our speakers clearly. If you have any audio issues, please check the volume on your computer or your mobile device. If that doesn't solve the issue, just let us know in the chat and we'll work to improve the audio as best we can. Now, let's take a look at today's agenda.
And as we've alluded to thus far, today's agenda will consist of top 10 lists from each of our guest panelists. First, from Jeff, we'll discuss the top 10 COVID-19 related issues affecting employers today. Of that top 10, Jeffrey will focus on the latest CDC and OSHA guidance, vaccine mandate trends and policies, anti-discrimination and accommodation requirements, and additional administrative measures. The top 10 recruiting recommendations will cover the best tips for creating a job post, offering attractive benefits, how to best use recruiting websites, along with targeting the best candidates. And then most importantly, for most of the people that attend our webinars regularly, the webinar will conclude with both Ashley and Jeffrey providing best tips for employers and answering questions from our audience.
Yes, and the format for today's webinar features a presentation of each top 10 list provided by our subject matter experts, prompted by a series of questions from the moderators. Where it makes sense, you'll hear from both speakers on specific topics, allowing us to give you a well-rounded presentation considering employment law and its effects on your workplace personnel. The purpose of this webinar is to provide accurate and authoritative information on the subject matter being discussed. It does not constitute legal advice. The applicability of the tips and laws discussed today may depend on your state, type of business, and number of employees. We recommend working directly with legal counsel and your human resources professionals on specific matters pertaining to your business. Personnel Concepts, our webinar hosts, and our guest speaker are not liable for any errors, omissions, changes in law, or advice that leads to unfavorable outcomes.
And thank you so much for that disclaimer. And before we get officially started with today's webinar, we'd like to take a chance or take some time to start off by asking our attendees a question. We'll do a poll. And that first poll we'll ask about, and what we typically start with is, what are you most interested in learning about today? So we want to know if you're interested in the updated CDC and OSHA guidance. Is it B, the vaccine mandate trends? Is it C, creating attractive job posts? D, targeting the best candidates for your open positions? Or is it E, anti-discrimination rules related to COVID-19? And we've got a good sized audience today. We'll give you guys just a few moments to tap in with your answers. I can see one already taking the lead. About 50% of you guys have voted. I'll give you about 10 more seconds here. All right, and I'll go ahead and share the results. It looks like 75% of you are looking for updated CDC and OSHA guidance, with another 50% looking for anti-discrimination rules related to COVID, and then 57% looking for vaccine mandate trends.
Thanks to our audience. Now, before we begin, Personnel Concepts is offering all of our attendees employment laws during COVID-19 frequently asked questions guide, which is attached as a handout right here in GoToWebinar. At the end of the session, you'll receive a downloadable certificate as proof of your attendance today. Also, I want to invite everyone in attendance to submit any questions you may have during the presentation using the Ask Question feature in GoToWebinar. I can see that some of you are already utilizing it. You can also post questions in the question window. Most questions will be saved for the end of the session, but those that are relevant to the subtopic being discussed will be posted where appropriate. And at the end of the session, you'll have an opportunity to use the raise hand feature in GoToWebinar to pose a question directly to our guest speakers. Now with that, let's get started with today's presentation.
Awesome. Now, Jeffrey, since the onset of COVID-19, employers have had to adapt to changes throughout the many seasons of the pandemic. In the current climate, policies facilitating the return to work to address the virus and its variants have led issues to be addressed by employers. Can you give us some background on the government guidance leading to employer action?
Absolutely, Leon. The first issue on our list today concerns the latest recommendations regarding masks and vaccines. The Centers for Disease Control and Prevention, or the CDC, has provided updated COVID-19 guidance throughout this pandemic. In its latest guidance, the CDC advises that fully vaccinated individuals should still wear masks in public indoor settings that are located in areas of substantial or high transmission. Now, what that means is, across the country, based upon reporting that's gone on, the CDC maintains an interactive map, and that map can be accessed through the CDC website, and it shows whether you are in, based on your zip code, an area of substantial, high, or even low transmission of COVID-19. People should be particularly careful in those areas that come up with the substantial or the high transmission. Here's some additional considerations from the CDC. Fully vaccinated people should continue to make informed decisions as to whether to continue to wear masks, so based on where they are. Fully vaccinated citizens should continue to wear a mask if they've come into close contact with someone who's been confirmed to have COVID-19 or who is suspected by them to have COVID-19. With back to school season now in full effect, the CDC recommends universal indoor masking for teachers, staff, students, and visitors to schools, regardless of vaccination status. And it's worth noting that that may change, as in the next coming weeks, it looks like the children will be eligible for vaccinations as well, as that's moving through the system. The CDC recommends that immunocompromised individuals should take heed to follow all previously established prevention measures, so don't let up on those if you're immunocompromised. And for outdoor settings, the CDC states that fully vaccinated people do not need to wear a mask generally, but may wish to continue to do so at a crowded event, especially if they have family members who are immunocompromised, or certainly if they themselves are immunocompromised. A crowded event could be something like a platform at a subway station, or if you're able to get out there and have any fun, maybe a concert, things like that, where a lot of people are gathered in a closed space. And those are the CDC's recommendations regarding masking and vaccinations at this time.
Thanks for reviewing those recommendations. And what has the Occupational Safety and Health Administration, or OSHA, offered for employers to consider?
Sure, Stephanie, and that's our second issue in our top 10 today, concerning safety and health guidance from OSHA. OSHA continues to recommend implementing what they call multiple layers of control in workplaces across the country to combat COVID-19 and its variants, including the Delta variant. Along with vaccination, key controls to help protect unvaccinated and other at-risk workers include, number one, removing from the workplace all infected persons. Additionally, maintaining ventilation systems, implementing physical distancing, properly using face coverings, and providing and encouraging the use of personal protective equipment or PPE. Employees may request reasonable accommodations to any of these measures. We'll talk about those a little bit more later. If they have a religious, perhaps, or disability-based need to not follow the measures, and what employers can do about that if they're facing the challenge. And then also OSHA notes that today healthcare settings remain subject to the most stringent requirements. So if you're in a hospital, for instance, and you work there, you should be following the strictest guidance that you've heard about so far to keep yourself safe.
Thanks, Jeff. And in addition to the CDC and OSHA, employers may need to account for Department of Health and Human Services and the Department of Justice in their preliminary guidance on long COVID disability accommodations. Can you give our listeners some guidance to consider for that?
I sure can. Issue number 3 relates to disability accommodations for those still suffering from health issues over a previous COVID case. Now, many people get better within days or weeks from COVID, but some people have continued to experience symptoms that can last for months after being infected, or they may have new or recurring symptoms at a later time, both physical and mental. Some of these symptoms are the symptoms that were associated with COVID-19 when they first had it, and those can be the fever, the chills, the loss of taste, things of that nature, and anything else associated with COVID the first time around. In addition to symptoms that they didn't even have the first time, which sometimes come around later on. Now, anybody who's experiencing these COVID-19 symptoms after having COVID-19, they're being called long haulers, and long haul COVID or long COVID is being recognized now by federal agencies as a disability under the Americans with Disabilities Act. So be ready for that, employers, going forward. Your ADA list of recognized disabilities will now include long haul COVID. That triggers under the ADA a few considerations. What are disabilities in the workplace? There's the actual disability, which is where a person sort of has a paper trail in their HR file where they've raised their disability and it's been noted. There's the record of disability, which is where they've raised it consistently throughout previous and current employers. And then there's this condition called regarded as disability, and that's when someone is thought to have a disability regardless of whether they've ever brought it up to HR or not. The employee must be provided reasonable accommodations by the employers if they have long haul COVID, unless such accommodations can be proven by the employer to constitute an undue hardship in the workplace.
Thank you so much, Jeffrey. That was an excellent explanation of long haul COVID, as I'm sure many employers will be dealing with that soon. And now that we've learned about general agency guidance on how to protect and accommodate within workplaces, it's time to move on to addressing vaccination status. So we want to actually poll our audience once again, and please get in your answers as quickly as possible, as we want to provide as much information as we can. This time around, we're asking, what vaccination requirements are currently in place for your employees? We like to know, do you require vaccine for all employees? Do you B, are vaccines required except when religious or medical restrictions apply? C, do you recommend vaccines for all employees? D, do you not recommend or discourage the vaccine? Or E, are you still developing a policy? And so we have people chiming in. We've got about 50% of the audience. We've got two neck and neck as far as the leading response. And this is an important one, so we'll just give a few more seconds here to get as much answers as we can. And we're now at 70%. I'll share with you all. It looks like 39% of you say that we recommend vaccines for all employees, which is a strong stance on that. 28% said we neither recommend or discourage the vaccine, with the others falling behind there, as you guys can see on your screen.
Yeah, and before we hop back in with Jeffrey and the guidance he has to offer in our next few vaccine-related considerations for employers, Ashley, does the audience's response reflect what you've seen in the workplaces?
Yes, it does. The majority of people that I've worked with and that my associates are working with are recommending the vaccines, mostly following state and federal guidelines, but everything is still in progress. So we're developing policies that evolve every day.
Yes, yes. And thank you so much for your input on that, Ashley. Now, Jeff, please jump in and explain some of the trends we've seen concerning the vaccine that employers may need to be aware of.
Yes, Leon, no problem. And I'm heartened to see that so many workplaces are encouraging the vaccine. I feel like I want to go work at those safe workplaces. And it actually also aligns with the data that's coming out of Washington, which is saying that the majority of US employers are encouraging but not requiring vaccinations. However, as the case of the Delta variant continues to rise in the United States and the universal accessibility of vaccines also continues to rise, we're of course now in the third round of the shot for many, these views may shift. Here's some other information to consider regarding vaccinations at the large scale level, the global picture. President Joe Biden's COVID-19 action plan has revealed vaccination success in targeted sectors of the workforce. As of recently reported, nearly 175 million Americans are vaccinated. That's about a little bit more than half of the US population. Through an emergency temporary standard, or an ETS, President Biden is planning to require that all employers with 100 or more employees ensure their workforce is fully vaccinated during this fall. President Biden has signed an executive order requiring all federal workers throughout the three different branches, executive, judicial, and congressional, and employees of government independent contractors as well, all be vaccinated. Healthcare personnel and other essential workers are the primary groups the CDC recommends continue to be vaccinated. And the Centers for Medicaid and Medicare Services, and those are both federally controlled through the funding aspect, those centers are taking action to require that any hospitals or institutions that receive federal funding also require vaccination of their personnel. And just to bring it up, while we're at it, there's also something going on right now in New York City where the mayor's office is requiring that the first responders get vaccinated, kind of a timely new issue. He's requiring that the first responders get vaccinated, and as an incentive, they're even offering money for people to go ahead and get vaccinated. So it's interesting to see where these trends are headed.
Thanks for that update, Jeff. I encourage our audience to stay tuned into Personnel Concepts blog for updates to national vaccine mandates. Jeffrey, can you explain the trend we've seen on the local level?
Yes, Stephanie, and that's the fifth issue of our top 10. The trends of localities in the United States to have received or not received vaccinations, they're largely impacted by political and economic factors, as we've heard in the news. It ranges based on where you are, and the transmission map the CDC has reflects to some extent where there's the most transmission, perhaps correlated to where there's the least vaccines. What's going on right now that's of a concern is that for employers out there, there's resistance from some employees. They don't want to be vaccinated. There's a concern about the impact of a mandate on company culture as well as employee morale. Keeping employees happy in a tight labor market is very important to employers. And there's a fear of loss of employees due to termination or resignation over the COVID-19 issue. So definitely a challenge for our employers to figure out how to handle this.
And then in the case that employers do want to mandate vaccines in the workplace, can you provide information on developing a compliant policy?
Absolutely, Leon. According to the CDC, the first step for employers seeking to develop and enforce a compliant COVID-19 vaccine policy, which, by the way, if you're keeping score, is the sixth issue of our top 10 list, is to build what they call vaccine confidence in the workplace. And this can be done a few ways. One of them is by encouraging leadership to step forward and making sure leadership represents a diverse sample of team members who are willing to share with staff their personal reasons for why they got vaccinated. Another suggestion is to create communication plans inside the office to share key messages with staff in such places as break rooms, with posters, through emails, and through other channels of mass communication with employees. Another way is to provide regular updates on topics to your workers, like the benefits, side effects, and effectiveness of vaccinations. And finally, if the employees are willing, making visible and celebrating individual decisions to get vaccinated, such as with a "I've been vaccinated" sticker, sort of like the "I voted" sticker, or on social media throughout the workplace. And again, all these things involving making leadership step forward and also making employees step forward and sort of, using them as an example of a model citizen. Those are all voluntary. It's important that I point out, don't force your employees to do that. Those are all voluntary willingnesses to come forward along those lines. Now, any employer developing a COVID-19 vaccination policy should be aware of certain circumstances where employers cannot require vaccinations, and these are called exemptions. The two main type of exemptions to note are going to be medical exemptions protected under the Americans with Disabilities Act and religious exemptions, which are protected under Title VII of the Civil Rights Act of 1964.
And in addition to employee mandates, most businesses that are open to the public have been forced to create COVID-19 policies for their customers as well. Jeffrey, could you break down the legality of masks and vaccine policies?
My pleasure, Stephanie. Very interesting topic. I've identified this as our 7th issue to discuss today. Generally speaking, a private business can set their own rules and policies for masking, which have been compared to the traditional, maybe 1980s, 1990s, if we remember, no shirt, no shoes, no service rules, which used to be posted on restaurant doors. As long as the policies the businesses develop do not discriminate against a protected class of people, either on their face, in other words, in the language of the policy, or with a discriminatory intent through the application of the policy. Now, what kinds of things do we have to be concerned about? Any policies that might affect people based upon race, color, religion, national origin, disability, or I'd even go as far to say in the COVID-19 era, economic status, which can sometimes be a proxy for racial issues. Because if there's certain populations that don't have access to good health care or can't get masks, that may be an issue as far as the mandating of things in the office. But in the businesses. But do remember though, the businesses do generally have right over their own private premises, as long as there's no discrimination. They can require proof of vaccination to enter the premises. They can require masking to enter the premises, which we've seen. Requiring patrons to provide proof of vaccination to enter a private business is not a violation of the confidentiality requirements of HIPAA. HIPAA applies to healthcare providers and not to private businesses that we go into for various kinds of goods and services. And while businesses and individuals maintain the right to ask others for their vaccination status, that doesn't mean that everyone coming in has to provide that information. It's a personal choice. And if you don't want to share your status, you can certainly not patronize that business and go somewhere else. And businesses, I'm sure, are going to be concerned with that, but they do have the right, wrapping it up sort of, to make that determination if they want to control who's vaccinated and masked coming in as a private business.
Very useful information, Jeff, especially about the HIPAA. So thank you for that. And now that we've learned about mandating COVID-19 policies for customers and patrons, Jeff, can you explain how to do so with employees while considering the anti-discrimination and anti-retaliation laws?
Sure, Leon. To address this 8th issue, employers can advise their supervisors and their managers of what they need to be watching for, stopping, and reporting any harassment and other discrimination. An employer should also make it clear that it will timely review any allegations of harassment or discrimination and take the appropriate actions if those allegations are brought their way. Here's a few considerations. Any disability-related inquiries or medical exams must be job-related, consistent with business necessity, and asked of all similarly situated applicants or employees. I know Ashley's going to talk a little bit about how jobs are posted and how people conduct the interviews. Anything related to COVID has to be similar across the board with all people coming in. Employers can help reduce the chance of harassment related to COVID-19 by explicitly communicating COVID-19 policies to their workforce. They need to ensure that management understands in advance how to recognize any harassment that could occur related to COVID-19. And they also have to be aware in this current context that harassment may take some different kinds of forms. These days, as we know from COVID-19, a lot of work is being conducted remotely. A lot of telework resources are being used. And you may see a report as an employer coming from someone in your team that says somebody harassed them about their vaccination or not vaccination status, or their previous sickness or not sickness, that was made to them in a web conference. And that's maybe a new way. What is the record keeping? What is the proof? Where do we go from here? What was the comment? These are things that have to be prepared for and treated the same way as perhaps an employer would have treated it if it came across from an email, or more traditionally if somebody passed somebody a note that was inappropriate. They have to be ready for all the new resources now being used and all the ways that these can help the bad actors as well as the good ones to prevent discrimination.
Thanks for those reminders, Jeffrey. Ashley, being an advocate for diversity in your HR role, do you have any tips for cultivating a workforce that avoids discrimination in connection with COVID-19?
I completely agree with everything that Jeffrey said. My policy is all for one and one for all. I'm gonna do my thing. But I would say making sure that you are asking the same questions across the board, that you have a very clear understanding and policy on not harassing your employees about their vaccination status. You can ask, but you can't force. Remember that, and you will be in a pretty good position.
Great advice, Ashley. Thanks again. Now, moving along as we head into the end of the calendar year, we need to discuss some of the back-end processes that employers will need to address as a result of the pandemic. Jeff, can you walk us through the employer tax subsidies that have been offered by the IRS recently?
Sure, Leon, you've saved some of the good news for employers till the end of my portion here. As the ninth issue, addressing record keeping for tax subsidies is very vital information to our employers. As the IRS has explained, the American Rescue Plan Act of 2021, or the ARP, allows small and mid-sized employers and even certain governmental employers to claim refundable tax credits that could reimburse them for the costs of providing paid sick and family leave to their employees due to COVID-19 related illnesses. Where this breaks down is ARP tax credits are available to eligible employers who paid sick and family leave for a period of time ranging from April 1st, 2021 through September 30th, 2021. An eligible employer can be any business, including a tax-exempt organization or certain size governmental entities that has fewer than 500 employees. Eligible employers report their total paid sick and family leave wages and the eligible health plan expenses on something called IRS Form 941. Check with your tax and accounting personnel on how to find IRS Form 941 amongst the other 940 and probably more forms that are out there. I'm sure it's quickly available through the IRS website. And also COBRA is currently being allowed to be credited as what they call a premium assistance credit for each calendar quarter. Another thing that employers can put down on their taxes and hope for some breaks or assistance from the federal government.
Thanks, Jeff. And to round out the top 10 COVID-19 related issues affecting employers, Jeffrey suggested that we discuss utilizing contracting workers to fulfill workforce needs, which is a perfect transition into the second half of our presentation. Quick reminder, if you have any questions, please post them in the questions window so Ashley and Jeff can answer them at the end of the presentation. So with your permission, Jeffrey, we'd like to table your points until we reach that segment of Ashley's presentation.
Yes, of course. I will be here, Stephanie.
Yes, thanks, Jeff, for your patience. We'll definitely get back to that. And just before we move on to recruiting tips from Ashley, it's time that we engage our audience in a really quick with a poll in order to get some further understanding of their recruiting needs as they either replenish or expand their staffing needs coming out of the pandemic. So we have two quick polls for you guys. The first one is just two options here. And we'll ask, is your business currently struggling to fill open positions compared to before the pandemic? Are you understaffed and struggling to fill those open positions? That's your option A. Or B, now we are fully staffed and not experiencing any hiring issues. We got about 53% of the vote. We'll keep this one really quick. As I said, we'll get into a second one just in just a moment here. And I'll go ahead and close that. Looks like about 67% of you are understaffed and struggling to fill open positions, which is kind of what we thought and the reason why we are doing this webinar today. And then secondly, we want to know, what challenges has your organization faced regarding staffing during the pandemic? And in this question, you're going to actually check all that apply. Are you looking to fill multiple open positions? Do you suffer from having multiple open positions at once? Are you dealing with employee resignations? Are you having issues finding temporary labor to fill employees on leave? Do you not have enough job applicants? Or are your applicants just not the right fit? And I can, and just coming off reading the question, I see a whole lot of people saying that the applicants just do not fit the open positions that they have. But we definitely want to get as much data as we can on this question. So please hurry up and get those answers in. I'll give you about 5 more seconds. And we're just at 70%. So I'll share that. So it looks like 69% of you said that applicants just weren't the right fit, with another 59% saying that you are dealing with multiple open positions at once, which seems to be common in today's labor market.
And Ashley, considering the position of the audience, can you begin with some preliminary tips for recruiting in the current job climate?
Sure. My first tip is to be objective about your organization. The best thing for an employer to do if they're ready to start expanding is to take a step backwards, yes, and objectively look at your organization from the eyes of a prospective employee. So that means don't just add trendy benefits, even though we'll talk a little bit more about why those are a good thing later, and consider what attributes will make your company stand out to your prospective employees. After you realize the attractiveness of your organization, I would suggest that you assess your hiring needs with a few pre-screening questions. So my next tip will be to establish your hiring needs. To do so, you need to ask yourself the following. What are my motivations for hiring? How many people will I need for efficiency? What part of my budget can I allocate to search for the perfect organizational fit? And how soon do I need to fill an open role?
Great questions to ask. And what tips can you provide for finding the right applicants?
That's a great question, Stephanie. And my response is actually my third tip. Create conservative requirements for your applicants. When you're creating your job posting, be very clear about the requirements of the position. I've seen employers, due to negative prior experiences, inflate the skills, educational background, and the attributes necessary for the position. So once again, avoid inflating necessary skills, education, and experience. Make sure you embrace the need to train employees with aptitude and enthusiasm. After that, I would say you want to make sure you're developing a concise description for your applicants. So if your job description is very clear on your time commitment, your educational requirements, and the responsibilities, you can avoid meeting with people who clearly won't be able to fulfill those needs. So make sure you're highlighting your responsibilities in the post. Make sure you're clear about the educational requirements, and make sure you're providing an accurate time commitment. I've seen many people walk into interviews and think that they're walking into a 9 to 5, and it turns out to be a 9 to 9. And now we have even fewer people who want to be in that role. So be realistic with everything you do.
Thanks again, Ashley. Now, Jeff, just to add to that, is there anything that you can give us to ensure that employers are creating job descriptions that are compliant with anti-discrimination laws from a lawyer standpoint?
Sure. Well, Ashley pointed out to be realistic in what you do, and I would also say be fair and equitable in what you do. The issue with the job process, all the way from the posting of a job through the day when the sun perhaps sets on you're working with the employee, all of those aspects of it, from posting the job through hiring, through working conditions, and through termination, they all have to be equally applied as to all. So in terms of not having any discrimination issues in terms of religion or race or disability, make sure that you're fair and upfront about the needs. As far as posting jobs, if you're going to have something related to this COVID-19 pandemic that's going to be related to the work, make sure that it's applied to all persons doing the same type of job. And also make sure that it's related to the business necessity. If you're going to say that someone has to be vaccinated, it would make more sense if they worked in a warehouse than perhaps if they were on the road driving the truck and barely interacted with anybody. That's sort of just an example. I'm not going to let anybody hold me to it, but just to give you a sense, it definitely should be job related if you're making COVID-19 related requirements. And that's how you keep it fair. And fairness is just as important as being real. So.
Thanks for that input, Jeff. Ashley, now that we understand the employment law benefits that are extended to employees, what can a business offer that makes them attractive?
Well, the answer to that question is my fifth tip. Employers need to use benefits to attract their prospective employees. So when fiscally possible, offer your employees the same benefits that would excite you if you were in their shoes. Coffee and bagels are not the key to a happy and healthy workplace. So over the past few years, the push for more employers to provide higher wages, 401ks, health, dental, and vision benefits, flexible work schedules, and paid time off have increased. So make sure that you are researching different benefit offerings. Make sure you're looking at your competition, similar companies, see what's attracting people to them. And you will have a better idea of how to navigate the benefits and navigate, I guess, fluffing yourself out for your team. But then my sixth tip would be aimed at holding on to your current employees. So make sure that you're retaining your current staff. Keep an eye on any challenges that your employees may face, like high insurance costs, childcare needs, mental health support, high rent by area. You may need, or you may find a common trend if you're looking into these things, and you'll see that it may apply or appeal to your applicants. There's a lot that can be said about before the pandemic. There were plenty of companies who were resistant and hesitant about the idea of offering working from home. Now that we've learned that most of us can actually do that, maybe it's time to really think about that as being a benefit in the long term.
Yes, thank you, Ashley. I'm sure a lot of people would definitely appreciate that. And then, and like I said, we appreciate your guidance on how to attract applicants, but we also need to address employers that are having issues with making contact with suitable workers. And as we saw by the poll, about 70% of them said that, hey, our applicants just do not fit with what we're trying to hire. So I want to ask the audience now, what systems and methods are you currently using for hiring? You're going to select all that apply in this instance. Are you using recruiting websites and internet posts? Are you just using internal job posts? Are you C, using traditional publications like newspapers, classifieds, job wanted ads, etc.? D, are you still conducting job fairs or participating in job fairs? Or E, if you have another option, please select that. Unfortunately, we can't have you type in an answer, but we still want to know. And remember, you're going to select all that apply in this instance. We've got about 60% of you guys. Please give us 5 or 6% more, and we'll move on and get to this information here. Looks like we're right at about 68. In one more second, we'll be at 70%. And I'll share you all what we got here. It looks like 84% of you, and this is kind of what we would figure here, are using recruiting websites and internet posts.
Thanks again to our audience. Ashley, it looks like to the responses we received align with your seventh tip for today's presentation. Can you give us some additional insight?
I sure can. So sites like LinkedIn, ZipRecruiter, and Indeed are popular choices for employers to use as a resource when they're searching for new staff members. There are specialized sites like I Hire Chef, which is a website geared towards job placement in the culinary industry, EdJoin, which is an education-focused job board, and those can be used to easily specify who and what you're looking for. So if your field is fortunate enough to have a specialized site, you have a lower chance of finding applicants who will not fit the bill. I think one of the most important things to keep in mind with this is that your resume is really just a precursor and a quick introduction into who you are. Making sure that when you're asking questions while you're interviewing and being fair and you're talking to everybody, you find out all of the information that will be relevant to the position, as well as the personality type who will be fitting into your team. That will be really, really important. So but that actually is a quick segue into recruiting your current and your former employees. So that would be my 8th tip. I often suggest that established companies, they look within their current workforce. I'm a huge advocate for succession planning. So if you see somebody who has some skills that might be transferable to another position that's in more demand and that you're potentially having a hard time filling, maybe you should do some cross training. If the employee leaves the company or if their work has merited promotion, it's a good idea to look at your workforce and see who has these skills. Consider rehiring former employees who left in positive standing. And if they were laid off as a result of COVID-19, definitely think about bringing them back on. It improves morale and it saves on training and onboarding time because they already know what you're doing. Another underutilized resource, which I think people really need to look at, is a state unemployment job board. A lot of people turn their resumes into the state for help finding positions, for advice on how to move forward in their careers, and it's an underutilized resource. So if you're checking in with your state, you might find people who won't have LinkedIn, who wouldn't know about ZipRecruiter. It's actually a really great way to bring in potentially older workers or even younger workers and find that balance within your team.
Those are some great tips, Ashley. As we previously mentioned, hiring independent contractors is an option that should be exercised by employers to perform tasks within their organizations. Before Jeff offers the pros and cons of hiring contract workers, Ashley, could you give us your thoughts on hiring contracted workers?
Well, at number 9, I'd like to remind you that your organization should seriously consider working with independent contractors. As more and more people switch from full-time employment to entrepreneurship, post-COVID, a gig economy would actually be the short-term answer to your long-term goals. So websites like Upwork and Fiverr, they may be a key to finding some skilled laborers, sometimes at lower cost than a full-time employee. If in some cases, you may be even able to contract those people to work on a full-time basis.
Yeah, and to add to your point, Ashley, businesses returning to work in this challenging labor market are looking for the best way forward to build a pandemic-hardened workforce. And there's some considerations for our business community about the pros and cons of hiring independent contractors, also called 1099 personnel, versus traditional, also called W-2 personnel, employees. Here's some pros: staffing flexibility, trial evaluation of individuals coming in, reduced costs, and reduce legal liability because they're not your employees for a very long time, just on a task by task basis. But here's some cons: less control over how they perform their work and what tools they use and when they do the work. Safety issues because you're not really monitoring them or necessarily controlling their work site. Liability for injuries because they may not be covered by your insurance the same way. And believe it or not, they could be potentially harder to terminate independent contractors because everything is based on contract and less the at will that we're used to when we deal with people that are full-time employees.
You know what? In addition to the cons highlighted by Jeff, an independent contractor may have multiple clients within the same or similar industries, and that could create some conflicts of interest, or they may not be available at all the requested hours, or they might be in a different location and have a time difference. So make sure that you're maintaining flexibility and following the laws of your state's independent contractor regulations. That's the key to ensuring that you avoid legal issues down the line.
Thanks again, Ashley. You've provided one last tip for employers to help fulfill their recruiting needs. And although it's last, it's certainly not least. What is the role of the company culture in the recruiting process?
This is my favorite tip and my 10th. So I'd like to instill in the audience that your interview and onboarding processes set the tone for the employee experience, and they're the hallmark for your company culture. You need to continuously maintain the values you set as an employer. So as an HR consultant, I focus my work on the importance of curating strong company cultures to help your business thrive. I would say in the interview process, make sure you're asking compliant interview questions. Assess the need to inquire about the vaccination status. And well, that goes back to Jeffrey's point earlier. If you are not really interacting with a lot of people or you're remote, do you have the same requirement that they be vaccinated? But then also observe your state, federal, and local laws throughout the screening process. Fast forwarding, during the onboarding, now you've hired someone. Remember that when you're developing your culture, you may face some pushback from other key decision makers because they're kind of used to how you've done things before. Maintaining transparency in that process will be way, way, way more helpful than trying to do everything behind closed doors and just saying, okay, this is what we're doing now. People kind of need a little bit more than that. Then you make sure that you're organizing the schedule of your new employees for the first few days in ways that allow them to acclimate to their new environment. Not doing so can lead to information overload and culture shock, not just for them, but for your other employees. They may have been used to the person who was in that position before. Now everyone has to get readjusted to working styles. Then you make sure that you set meetings with key players and staff that are designed to explain any confidential information, perks, programs, and clear up any lingering questions.
Thank you, Ashley. You provided some excellent tips for employers to assist in their recruiting process. And before we segue into our live question and answer session with our audience first, let this be a reminder to everyone to submit any last minute questions. We're definitely going to get them over to our guest speakers today. They are subject matter experts and would love to answer your questions live today. And then second, let's go ahead and recap the top 10 list that we provided for each subject, starting with you, Jeff.
My pleasure. Let's do it, Leon. The top 10 things that I went over today are: number 1, CDC mask and vaccine indoor and outdoor recommendations. Number 2, OSHA guidance on preventing the spread of COVID-19 and variants in the workplace. Number 3, precautionary long COVID disability accommodations for employees. Number 4, industry-specific vaccine trends. Number 5, local and municipal vaccine mandate trends. Number 6, developing a compliant vaccine policy for employees. Number 7, legally requiring masks and vaccinations for patrons of your business. Number 8, anti-discrimination and anti-retaliation considerations when mandating COVID-19 policies. Number 9, record keeping and paid sick leave, COBRA, and other employer tax subsidies available from the IRS. And number 10, utilizing contract workers when appropriate.
And here's my recap of the top 10 tips for resolving issues in response to COVID-19. 1 is be objective about your organization. 2, establish your hiring needs. 3, create conservative requirements for your applicants. 4, develop a concise job description for your applicants. 5, use benefits to attract prospective employees. 6, improve benefits for your current employees. 7, utilize social networking recruiting sites to find talent. 9, recruit current and former employees. I'm sorry, that's 8. 9 would be utilizing contract workers when appropriate. And 10, cultivating a desirable company culture.
Thank you both so much for going over your top 10. Before we end today's session, I'd like to remind everyone that all attendees will receive a follow-up email with a certificate as proof of attendance to today's webinar. Let's take a moment to answer some of the audience questions that were submitted during the presentation. So it's just going to be like a fire round. I'm just going to go around. Some may be directed directly at Jeff or Ashley, or we would like to hear your input, both of your input on some of the questions as well. So we have a question here. Is it okay to require new staff to be vaccinated when not all of the current staff is or will be vaccinated?
I guess I should jump in. I'll take that one. It's okay, but going back to what we discussed, vaccine mandates and mask mandates and COVID-19 related mandates in general, in case I'm missing anything, the testing perhaps, they have to be related to the workplace necessity. So if you're going to have new workers separated from old workers, there better be a reason in effect for why it is that you've only made the new workers be vaccinated. Now, if they're doing different jobs, that would be a reason, a business necessity. If they're doing the same job and you're merely expanding the workforce, you may have to think about having the old employees follow the same protocols as the new employees, because otherwise you could be separating people out, which could be implied to be discriminatory. How could that be? I want to go all the way with this for you, for our asker. If perhaps the people coming in are new employees who've been out of work for a long time, there could be an economic disadvantage there. And the economic disadvantage could lead to allegations of discrimination, because poor has been sometimes used to construe a discriminatory basis, and unemployed could lead to that. So you want to make sure that you don't open the door for that. You're going to want to try to have all of your workers who are similarly situated follow the same COVID-19 requirements, including the vaccinations, as I said, the masking, and if so, the testing.
Very well put, Jeff. Ashley, I think this one's more geared towards you. Hopefully you can answer this for us. In hiring for open positions, we noticed many candidates did not show up for the second round of interviews. Due to the competitive job market, do you recommend holding multiple rounds of interviews on the same day?
Oh, that's actually a tough one. I go either way with this, and it depends upon the structure of your interview process and also how soon you need someone in there. Personally, I like 4 steps. So I like the preliminary phone call, then I like, a conversation with either the recruiter or the manager, maybe one with a team member, and then maybe one who's, someone like myself or even higher up in the organization. I know some CEOs who want to meet everybody from just the person who presses send on the mail. They want to meet everyone and make sure that they understand the company that they're working with. That being said, having a rapid fire round in the same day can be so convenient. I've seen places where people have to take off of work in order to interview, and doing that on multiple days and driving yourself crazy, that can be a lot. So I do like getting everything done in one day, but I will say that leads, unless you schedule your time impeccably, you probably won't have that segue to really think about the impression that's being left on you, I don't necessarily want to suggest that you immediately just say, oh, I love this person. No, I don't like this person. Sometimes it takes a couple of rounds to, or a couple of different opinions to actually figure out, okay, how can we work with this person and communicate with your team members before they're even, in the position. Like, you know what? They brought up something that I didn't even think to ask. Maybe we need to revise our process. So if you're going to do it one day, I kind of think that it should have a little bit of space. So maybe 1 in the morning, 2 in the afternoon, a working lunch, something like that. But always making sure that you are not just hiring and one and done is really important to me. That normally doesn't work out.
Great tip, Ashley. Thanks so much. We have another question from our audience here. Many states had COVID paid sick leave that have run out. Do you have any insight as if to when these may be extended, or if can and should my company provide this type of leave?
That's a Jeff question. Jeffrey.
The handoff. Well, I'll take it. The question, the answer to is it likely that more COVID relief will come from assistance from the state? It would appear to be, and don't hold me to it, and I sure hope that it's true. It would appear to be that we're on the second half or the back end, so back nine for the golfers of COVID. It would appear, with that being the case, that the programs that were designed to provide aid to businesses are going to start to go away. We know that the federal assistance for unemployment extensions has gone away. States are one by one beginning to lift the emergency orders that were put in by the governor's office. And with these things being removed, the special appropriations that were coming from the states to help businesses with their workforce are going to begin to sort of go away. We talked about some of the ones available from the IRS, and the federal government tends to move a little bit more slowly than the states. So they're still seeing some relief there. The question of whether or not you're going to get assistance in paying your employees for the sick time on a state-by-state basis, that funding is probably going to dry up. Should you allow them to take more sick time related to COVID? My answer is going to be yes. I think that's a best practice. I think the reason why is because we're seeing COVID be treated as a disability, as we mentioned during the presentation. And also, it's a murky area to sort of tell a person whether or not they're sick when we're dealing with a disease that's relatively new, that has a wide range of effects. So if a person tells you they're sick related to COVID, if you want to keep that person employed, I would recommend trying to find a way to allow them to use sick time. Now, if you do that and they run out of sick time, a lot of companies, as Ashley knows better than me, a lot of companies have switched over to a PTO model where you run out of sick time and you use your PTO. And when you run out of PTO, then it's another conversation. That's how they treat other kinds of prolonged leave for sickness. Once you use up your available sick time, you can eat into your vacation time and you can eat into your other PTO, which is more generally called now in the workplace. And you don't have to really address the issue until all that time is used up. So my recommendation is yes, allow the employees to take off. Don't quibble about the details when it's COVID related. I realize that opens up a lot of possibilities, but let them run through their PTO. And then if their PTO is gone, theoretically, they probably are almost at the end of their COVID symptoms. I mean, they have to be very, very prolonged, and then have the conversation about where to go from there. Because if it lasts longer than the PTO, we're probably in the disability land. And that's going to be long haul COVID, and that's going to be different accommodations. The way you treat any employee who has an ADA recognized disability. Recognized, excuse me. Little local slang in my voice there. Recognized, sorry.
Can I actually say that one of the things that I've been seeing with my clients is there are some who have PTO, there are some who have unlimited vacation. They've actually been creating a separate bank, which would be, I guess, maybe 2 or 3 days worth of time. So if we're looking at 2 days and maybe 16 hours of just discretionary time. If you think you have a cold, if you think you're not feeling well, it's kind of nice to add that on and pad it. Once again, a benefit that you can think about for your team. But particularly with COVID-19, sometimes it's just hard to get a test. It's a little hard to get an appointment. And you might need to go to different locations, or your child may be sick or something of that nature. So making sure that you're just keeping keeping yourself flexible, understanding that this is a very human experience. I like to call it, in a way, the great equalizer, because this has affected all of us. I think that that could actually really help in the long term, in the perception that your employees have for you, and also just, generate more business for yourself. People like
Yeah,
hearing things like this.
a great point too. Just another aspect of it, don't risk bringing somebody with COVID into the workplace. If they tell you that they think they're sick and you say come to work anyway, you may run the risk of making 10 more employees sick, and that is not going to help your bottom line. So if somebody tells you they think they have COVID, take it seriously, because the CDC is recommending that you remove those people from the workplace, not challenge them about whether it's COVID or the flu. You'd be better off letting them stay out than bringing them in and risking more workers.
That's actually one of the questions we have. Can an employer delay the start date of an applicant who has COVID-19 or symptoms associated with it?
Absolutely. It's honestly, with the day that you choose to bring someone into your organization is completely up to you. Of course, you have to weigh the, pros and cons of delaying that, see whether or not the people who are currently covering that role can actually handle the responsibilities for longer. But of course, you can push a date back. Honestly, it's better to do that than to have someone who potentially is maybe not as focused, isn't feeling well, just physically. Anyone who's had COVID-19 can tell you, you can't think. It's very hard to think and function sometimes. So just be aware.
Yeah, definitely. Thanks so much for responding to that. Turning to something slightly different. So, how do you recommend dealing with high turnaround due to not having enough staff to support our current staff?
That's Ashley.
Um, That's a big question. That goes back to both of us talking about independent contractors, and looking for those who want more flexibility in their schedules, more flexibility in their lives. It's a great resource. It's not like a couple of years ago when people would just hire an intern to do things that they didn't want to do. Actually having skilled workers, people who can, stick to a time commitment, or, at least have an understanding of what it is that you need. You can absolutely pad out your workforce. It's a little harder when it requires somebody to be on hand, but that goes back to me saying former employees who left in good standing, even, sometimes phone a friend where, who can throw a hand in and see what they can do for you. But there are resources, you just have to be creative.
Thanks so much, Ashley. We have another question here. Suppose a manager learns that an employee has COVID-19 or has symptoms associated with the illness. The manager knows she must report it, but is worried about violating ADA confidentiality. What should she do?
Well, yeah, I guess I'll
Okay.
take that one. If the employer suspects that the person has COVID, it wouldn't necessarily be the ADA yet, to the person asking the question. The ADA is going to apply to long haulers. So assuming that the person is a person sort of on the floor who's suspected to have COVID, the issue is going to be, how do you get them to come forward with that information so that now you know what to do next? Obviously, the end result is you should send them home, and they shouldn't be working because they're a risk to the workplace. In terms of whether or not you can ask them to disclose and to confirm your suspicion that they have COVID, this is kind of the people are talking about it in the office, but the person who has it doesn't want to admit it. More than not, the law is going to side with your ability to ask that question based upon business necessity. So anything that would come up as far as the violations of any of the things, again, you're not well, you are because of HIPAA because you're the employer, but if you have to ask that question, the business necessity is going to generally override the confidentiality, and you can ask them if they have, well, what the best way to do it is to require them to test. You may have to find yourself requiring all the employees who are similarly situated to test, but you can require them to test. Some employers provide the test, some employers make the employees go and get the test. Ashley pointed out it can be very difficult on any given day versus any other day to get a test. It depends. There are runs on tests, like there have been runs on toilet paper and other strange items during COVID. There was a run on windshield washer fluid a few weeks ago. I don't know why, but things run out, and COVID tests could run out. But there's different ways to do it. Probably the COVID testing mandated for all employees, if you think there's a suspicion of one, is the safest way to do it. The next way to do it is to call them into the office, provide as much confidentiality as possible, and say there's a concern that you have COVID. Can you confirm or deny that? It's not a disability at that level. It's a business necessity. It's a question that poses immediate danger to the workplace. I think you'd be protected if you had to ask that question, as long as you didn't embarrass them in front of other people. And I think that's what you have to do. I think you have to, create a policy and let that be the policy. If someone is suspected of having COVID, they may be required to test or disclose. And as long as it's applied to everybody, it should be okay. A lot of people work in tight spots, tight spaces, and COVID could spread quickly. It's a highly transmittable disease. So business necessity will protect you if you have to ask that question. Just make sure you are fair and equal to all at the workplace.
Very well put, Jeff. Well, we have come up to, oh, did you want to add something, Ashley? Sorry.
I did really, really quickly. Also,
Sure.
there are at-home COVID tests that are available. So it's a really good idea to just stock up on those and keep them in your workplace. I suggest that to all of my clients. And you can even, if you suspect this person has it, you can say, hey, we actually have a test on hand if you would like to take it. If not, we totally understand. But just having that, available, it could be helpful.
Thanks so much for the input, Ashley. And thanks so much for both of you for answering those questions. Unfortunately, we've run out of time. All of those unanswered questions will be forwarded to Jeffrey and Ashley via email, and the responses will be sent to all attendees in the coming days, along with a copy of the webinar. So thanks for everyone who submitted questions about today's topic, and special thanks to Jeffrey and Ashley for taking the time to answer them.
Thank you for having us.
It's a real pleasure to be here.
Yes, we enjoyed you guys so much, and we enjoy hosting webinars in general. For our valued customers as such, we would really appreciate your feedback. So please stick around just a couple minutes, as a brief survey will open up for you to rate what you saw and heard today. And then while you're still in the session now, make sure you grab those handouts that are available to you. We've got one, frequently asked questions about COVID-19 that actually Jeff participated on. And then also, we have today's webinar slide. So if you like what you saw today and need some more information from the slide presentation, please go ahead and download that as well. And this concludes today's webinar. Thank you for attending our presentation. We hope you found this information useful in understanding the long haul effects on policy and personnel in the workplace in response to COVID-19. Thanks to Jeffrey and Ashley. Thank you guys so very much. It was very special with you guys today as our guest panelists, and we look forward to continuing to working with them on future presentations. And if you enjoyed today's webinar, we invite you to view past webinars on demand at the link provided on the screen. Also, please subscribe to Personnel Concepts Podcast, the Labor Law Report, for bi-weekly employment law updates hosted by myself and Stephanie Balicki, who's the co-moderator today. And you can access that by using the QR code that you see on the screen now as well. And to all of our attendees, thank you for choosing Personnel Concepts as your provider of workplace compliance solutions, and have a good afternoon, everyone.